Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Happy Nurse Practitioner Week. I hope that all of y'all are having a great week this far. And I hope you are taking advantage of the giveaways and different things that I have been offering this week. I hope that y'all found them helpful. And again, thank you for all that you do. All right, question number one for today. A 56-year-old male presents with a 6-month history of heartburn, regurgitation, and a chronic cough, especially at night. He reports taking over the counter antacids, which provide only temporary relief. His symptoms worsen when lying flat or after eating large meals. His physical exam is unremarkable, but he appears overweight. What is the most appropriate next step in the management of the patient with suspected GERD? Is it A, to prescribe a PPI, B, recommend a trial of dietary modifications and elevate the head of the bed without further pharmacologic treatment, C, start an H2 blocker, or D, schedule the patient to follow up in 1 week? Take a moment and tell me what you got. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, what is the most appropriate next step in the management of this patient with suspected GERD? All right, so the best answer here is a PPI. You want to go ahead and start them on a PPI. Now, if you look at my videos, I know at one point we used to start as first line therapy with an H2 blocker. But remember, guidelines have changed, and make sure you know this for testing purposes because this is what they're testing on now. The current guidelines state if there is a GERD diagnosis, you start with a PPI. So A is your best answer. Question number two, a 28-year-old female presents with a 12-hour history of a severe headache, nausea, and photophobia. The headache begins suddenly and is described as throbbing, localized on one side of her head. She reports no recent history of head trauma or neurological deficits. She has a known history of episodic migraines, which she typically manages with over the counter analgesics. What is the most appropriate treatment for the patient presenting with an acute migraine attack? Is it A, prescribe a sumatriptan and recommend resting in a dark room? B, recommend over the counter ibuprofen and encourage hydration? C, initiate a prophylactic therapy such as propranolol? Or D, advise her to continue the over the counter analgesics and follow up in 1 week? What do y'all think? Tell me what you got in the comments. All right, here, stem of the question is, what is the most appropriate treatment for this patient presenting with an acute migraine attack? So this is the benefit of reading the stem first because this stem tells you everything you need to know. How do you treat an acute migraine attack is solely what this question wants to know. Now the scenario does provide you with all the symptoms, the assessment findings that tells you that they have an acute migraine. But the stem already lets you know that the diagnosis is acute migraine and they want to know how you treat it. So the best answer is A. For acute therapy, we prescribe triptans, right? So you want to give them a sumatriptan and recommend resting in a dark room. If they said prophylactic therapy, then we would have went with C. But here again, A is your best answer. And then lastly, question number three, a 4-year-old boy presents with dry, red, and itchy patches on his cheeks, elbows, and behind his knees. The mother reports that the child has had this condition since infancy and that the flare ups occur when the weather is dry or after using scented soaps. The child has a family history of eczema and asthma. On exam, you note excoriated erythematous plaques with areas of lacinification, What is the most appropriate treatment for this atopic dermatitis? Is it A, to prescribe a high potency topical corticosteroid? B, recommend frequent use of emollients and topical corticosteroids as needed? C, initiate oral antibiotics for secondary infection? Or D, phototherapy? Take a moment and tell me what you got. All right, so stem of the question states on exam, you note excoriated erythematous plaques with areas of lichenification. So, what is the most appropriate treatment for this atopic dermatitis? Again, how do you treat atopic dermatitis is simply all this is asking you. The scenario just basically explains what this child has going on. And your best answer is going to be B. You want to recommend that they frequently use emollients because with eczema, you want to make sure that they are moisturized, and then you can have topical corticosteroids as needed for flare ups. We don't want to just prescribe anything high potency. If not warranted, you want to definitely start with this first line with the emollients and having those topicals PRN, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number one at gmail.com. The things that I do offer are all linked in the bio of this channel, to include my review book. You can get it in the ebook or paperback option, the self-paced review course for those of you who prefer to study independently, the QBank options for those of you who are looking to do practice questions to study and to test your application of your knowledge. And as always, if you're looking to book any one-on-one sessions, I always say either call, text, or email, as I offer a variety of one-on-one session types. And I prefer to speak with you first to gauge what you truly need to make sure that you're booking the appropriate session. All right, you guys, as always, y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.